Hello again, my friends. Today I want to talk about hormonal acne. So many people think hormonal acne means there's something wrong with them, that something's out of whack, their hormones are out of control. They start going to get blood work done, and they find out there's actually nothing wrong. Hormonal acne is really a way to just describe the distribution of the acne and where it is on your face. Yes, there are some medical conditions that can cause hormonal acne, and we'll get into those today. But today I'll just break down for you simply what hormonal acne is and the best ways to treat it. So, where do we get hormonal acne? As I said, it's about the location on your face. And actually, it also can happen on your neck. So, most of the times that people say you have hormonal acne is they're referring to the jawline acne. It could also be on the chin. And then sometimes you'll see it in this neck area. And typically, these pimples are cystic, they're painful, they could be nodules. And if left untreated, they can cause scars. So, we all have oil glands on our skin, and some of us have more than others. But what happens in hormonal acne is we have androgens, which are, we can break them down into testosterone and something called DHT, which is dihydrotestosterone. And these can act on those oil glands and cause the oil glands to produce more oil and more inflammation, which can then lead to these deep, painful cystic bumps on our skin. So, why do we call this hormonal acne versus just saying you have acne? And as I mentioned, it has to do with hormones. So, if you are someone who is about to get your menstrual cycle or you're currently on your period, then you'll notice that you'll probably have an increase in those cystic bumps that are on your chin and your jawline, maybe even under your chin, leading into your neck area. And that's because as your menstrual cycle approaches, you have an increase in androgens that are moving around and binding to those oil glands and causing an increase in inflammation. So this is very normal, and you will notice that these types of pimples and cystic nodules will flare with your menstrual cycle. So, as I mentioned earlier, there are other conditions, underlying medical conditions that can be related to hormonal acne. And one of the most common ones that I see in patients is called polycystic ovarian syndrome, abbreviated as PCOS. You may have this, you may have never heard of it, but it's very common, again, amongst women in their 20s and 30s. And what happens is usually you'll notice either you'll start to grow hair on the chin line, which is called hirsutism, and you'll also notice that you'll get cystic acne around your menstrual cycle. You may be suffering with type 2 diabetes as well, have irregular menstrual cycles and painful periods. Sometimes people with PCOS also struggle with infertility. So, this is a very, very common cause of hormonal acne, and there are great ways to treat it. I also want to point out that if you're someone that has PCOS or another underlying medical condition where you have a hyperandrogen state and you have an increase in androgens, testosterone, DHT, you may have gotten blood work to prove that your hormones are, out of balance, which by the way, as I mentioned early on in this video, is not everybody that has hormonal acne. But if that sounds like you may notice that your skin is oilier and shinier because it's very typical of patients who have an increase in these androgens and hormones to have oilier skin, which unfortunately acne loves to live in an oily environment. So that oily skin is they feed off of it. The bacteria feed off of it, creates more cystic acne and more inflammation. So, one of the ways that we try to treat you is by combating that oil, decreasing the oil production to try to get rid of the inflammation and the acne. And we'll get into the treatments very shortly. So, stick with me. If you have learned something by now, I hope you have. Subscribe, give this channel a like. Also, I want to mention that a lot of people ask me, does diet correlate with my acne? So, in terms of hormonal acne, and I should mention that the science right now that we have is not great. Like, we know certain things are that we eat correlate with maybe a spike in acne, but there's still a lot more research to be done. So I'll just put that out there. But what we do know is if someone has diabetes and they are eating an increase in highly processed sugary foods, we see an increase in a hormone called insulin-like growth factor. And that insulin-like growth factor hormone acts on the oil glands, so it kind of like attacks the oil glands and increases the oil production, which leads obviously to more acne. So we do see a correlation between obesity, diabetics, a highly processed sugary diet, and an increase in hormonal acne. I should also point out that people who drink skim milk have been seen to have an increase in resistant acne versus those who drink whole milk. So we think this is probably because of the same reason when someone eats candy, you get an increase in your glycemic load, and that spikes your insulin-like growth factor hormone, which is acting on those oil glands and increasing oil production. So the only two links that we really know for certain at this time that exist between food and acne is with candy and skim milk. Now, before we jump into treatments, which I know everyone is waiting to hear, I just want to reiterate that most women who have hormonal acne So acne that is in this U-shaped distribution on your chin, your jawline. Again, it can go under your chin towards your neck area. That's painful, deep, cystic nodules that can persist for a long time, flare with your menstrual cycle. Typically, they do not have any underlying medical conditions and their hormones are not out of whack. I really want to emphasize that because I don't want you to watch this video and start running to your doctor's office to ask for blood work because it's so common to get hormonal acne and everything is just fine with your blood work and you won't find any abnormalities. So now let's get into the treatments. It's important to treat your hormonal acne early on. So as soon as you start to notice that this is a problem that you're suffering with, and by the way, you may have hormonal acne with an excessive hair growth, which again is called hirsutism. You may see this hair growth on your chin, sometimes even down your neck towards your chest. A lot of times hormonal acne goes hand in hand with hirsutism. If you start to notice that this sounds like you and it's flaring with your acne, I want you to treat it early on because if you don't, it's very possible that you can get something called post-inflammatory hyperpigmentation or dark spots that take a very, very long time to treat that pigment that's left behind from the acne inflammation. And worse, you can be left with a scar. And scars are very difficult to treat. And I don't want you to have to deal with scars if you can help it. The best way to treat hormonal acne is with hormonal therapy. So these include an oral contraceptive pill, like a birth control pill, or something called spironolactone. These two medications are going to help keep those hormones in check and decrease that oil production and get rid of those cystic nodules that you're dealing with. And let me go into detail about what spironolactone is because you may have never heard of this before. Oral spironolactone is actually a blood pressure pill. So you're probably wondering, why in the world am I taking a blood pressure pill if I'm trying to treat my acne? So it's a potassium sparing diuretic. What that means is a diuretic is to help people get rid of excessive fluid and retention of water that they may be holding onto in their ankles or around their heart, and it gets rid of that excessive fluid. But we found that spironolactone actually works on treating very resistant, stubborn acne that is along the jawline and the chin. And that's because what it does is it binds to androgen receptors that are on oil glands and it blocks testosterone. So if you have a decrease in testosterone, and that means you have also a decrease in your DHT hormone. And with the decrease in these hormones, you'll get a decrease in oil production. And without oil production, there's no wonderful environment for your acne to thrive. So we found that spironolactone is really, really helpful. I would say actually 80% effective at treating your hormonal acne. Also, we know that if you are someone that is already taking an oral contraceptive birth control pill and you may still notice like your hormonal acne is not quite gone, we very often put patients on spironolactone in addition to their birth control pill, and we see a really great effect between the two medications. It's kind of like a synergistic effect, and it works really well against hormonal acne. I do also want to mention that if you're a male struggling with hormonal acne, which I didn't mention earlier, but men can also get hormonal acne because they have an increase in hormones as well, very common. They should not take oral spironolactone because we have found that oral spironolactone in men can cause gynecomastia, which is actually an increase in their breast tissue and they can kind of get male breast. So we advise all men to not use oral spironolactone if they want to treat their hormonal acne. So there are a few people who should not take oral spironolactone, and that's, as I mentioned, men, pregnancy. So do not take this if you're pregnant. If you already have low blood pressure at baseline, it's probably not a great medication for you because it's going to cause you to urinate more and lose more fluids. And if you're someone with poor kidney function, then it's not a great choice for you. But don't worry, there are other options. Accutane is another very effective treatment for hormonal acne, and I've seen great results in patients who have hormonal acne and have taken Accutane and they have achieved clear skin. Now, there are some other treatment options for hormonal acne, but I have not seen them to be as effective as the other ones I've already mentioned. And these include oral antibiotics like doxycycline, and you can also try topical options as well. So if you're someone who wants to try a retinoid, which I am such a big advocate for retinoids, but I have not seen that they're super effective for someone who has active hormonal acne. Retinoids are great if you had struggled with hormonal acne during some point in your life and you're now dealing with scars. I think retinoids do a really good job. But for active cystic nodules, I don't see a lot of improvement. I talked about oral options that are available for treating hormonal acne that are very effective, but I do want to add that obviously not everyone wants to take a pill, and there are topical options out there, and there's something actually exciting, and there's a new topical spironolactone called Winlevi, and this is available to both men and women because we have found that the topical option does not get systemically absorbed, so it's not going to cause any bad side effects for men. And the way to use this appropriately is you just use a pea-sized amount on those areas that you're seeing your acne flare in the morning and the evening. And people are getting really good results with this, and they're not having a lot of side effects. They're only getting mild stinging, a little redness and inflammation, but nothing major. And that seems to go away pretty quickly. Also, it seems to take effect very quickly. Within 12 weeks, you'll start to notice an improvement in your hormonal acne. But with that said, topical spironolactone is not nearly as effective as oral spironolactone. But not everyone wants to take a pill, so this might be a great option for you. All the treatment options I've mentioned so far require prescription. However, there are some over-the-counter options that you can try. These include benzoyl peroxide, salicylic acid, as well as azelaic acid. Azelaic acid is a great option if you're someone who's pregnant because it's very safe in pregnancy. These options are effective at decreasing the bacteria that causes the acne. And if you decrease the bacteria in those oil glands, you can help decrease the inflammation. I do want to encourage you to be patient. All the treatment options I mentioned require time, and I would say at least minimum 3 months until you see some sort of improvement in clearing of your skin. And that's a wrap, my friends. I hope I clarified what hormonal acne is, and now you can make sense of it all, what causes it, the best ways to treat it. If you have any questions or comments, leave them below. I would love to hear from you.